Welcome once again to Ask Me Anything on Diabetes. I'm your host, Dr. Aniket Banvi, and once again, we are here to address various questions that have been asked by people who are suffering from diabetes and the questions that they are looking forward to be answered by us. And I will straight get into the question that has been asked today. It's a lengthier one, and let me elaborate it. After discovering that I have diabetes with a fasting blood sugar level of 157 mg per dl and postprandial blood sugar level of 306, my doctor prescribed Glycomet 500. Now my sugar levels have reduced to 120 fasting and 150 postprandial. Please advise on what should I do next. Now, see, let me break it down. Now you are already under a doctor's guidance. Proceed with that same guidance. But I would ask you to check these things also in the coming days, the advice or the thing that you're seeking. Now, first and foremost, check your BMI, that is body mass index. If at all it is about 25, if you are overweight or grade 1 obese or whatever range you are, then correct it. That is the first thing that you should be taking care of. Correction of that. I don't know the further detail of it. This is a very generic one which I'm telling you. So check your BMI, body mass index. Then please make sure that you check your micronutrient levels, that is specifically vitamin D level and vitamin B12 level. Now, these are the measuring parameters that will give you an understanding of how is your health, how obese are you, or how overweight are you, and how is it impacting your diabetes, and what the deficiencies are there. How are your body's metabolism taking place? How is your body taking those raw materials and utilizing it? Is it sufficient or is it deficient? These are the two things that you will get to an understanding. Now, the next part would be is correction of your lifestyle. That is comes in two parts, which we say is that ahara and vihara. You're already on a medication. You're already under a allopathy doctor's guidance. So continue that. But apart from that, do these things also. First is correction of your food habits. That is ahara, because 60% of your diseases can be managed by what you eat. So make sure that you learn or understand the art of what should be eaten, what not to be eaten. Now, how do you do that? I make it as much as simple as possible. I ask most of my patients to ask them one question before they take any bite in their mouth. That is, whatever you're going to take inside your mouth, is it going to, or whatever you're going to eat, is it going to be healthy or is it going to be beneficial in improving your health? Yes or no? And the answer is right in front of you, and you will immediately know whether this is going to be very beneficial or no. And this is just a very generic question that I'm putting forth. There are multiple and many more layers to this. So make sure that you eat at the right time. Eat mostly recently, if you are able to go and browse through the ICMR and National Institution of Nutrition, where they say that what should be eaten less and what should be eaten more. In that, they specifically say that you should be eating more of plant-based foods, because they are rich in phytonutrients, they are good in micronutrients, they are beneficial in feeding your good bacteria, access probiotics, and has been very much beneficial in reducing the inflammation, helping people manage diabetes and many other lifestyle diseases also. This is not me saying, this is Indian Council of Medical Research and the National Institution of Nutrition saying this, and this is the guide that they have put or rolled it out. So make sure that you try to align yourself with those things. That is the food part. Vihara part, that is the lifestyle. Make sure that you're physically active, because lack of physical activity has been very much leading to many further more complications. Start as much as small as you can begin with. Start with walking or some kind of physical activity that you can do every day. Implement it. Apart from this, if I have to tell you something very specifically, please make sure that you are able to implement small changes. Know how to break your fast. I would suggest break your fast with fruits, nuts, or any kind of a salad if possible. Then please do not consume milk or coffee adding sugar and all those things. So make sure that you avoid those things. These are the small things will make a big difference in the long term. So the major chunk of it is um, majorly, as I said, check the BMI, body mass index, then check your micro deficiencies, which are vitamins and minerals, then implement the correction of food habits. As I said, eat a lot of greens, salads, and all of those things. This is not just the whole part of it. This is just the answer is not complete. You have to have a balance of good amount of complex carbohydrates, then adding with a good amount of fats and then proteins also in your diet. You should have a balanced diet. Then vihara, physical activity, manage your stress level, have a good amount of sleep, at least 7 to 8 hours. That will help you in much more long term. All of these things coming in the alignment with the course that you are on with the doctor should be helping you in the long term. So this is what you should be approaching. This is how you should be going forward in the course. So this would be my advice. This is a very generic. Each case to case is very different. I have to study. I have to take case history. You have to sit down, consult us or consult me um, on our website, and I can understand the case and then I can review it properly. This is a vague and very generic one which I'm giving to layman person also to understand how the approach should be, what way you should be thinking. So this is not the ultimate answer, and there is no one fixed rule or the one fixed mantra that would work for everyone. We can give you a direction. There will be some tweaks and some corrections in that whole process. So what works for one person might not work for the other person. So make sure that you sit down, consult a doctor, and if you are on one course or with one doctor, finish that course thoroughly. In spite of that, if it is not working over a period of time, then look for the another doctor or to understand much better why is it not happening. How can the things be much better? You can search for the answer, you can explore more to understand, um, to make sure that you stay healthy, to make sure that you are able to knock diabetes from your life, to make sure that you are able to know what is your body functioning and how is it responding at each time. So with that, I hope I've answered. The answer is very much complex. I have given it in very vague and a very generic manner. There is no hard and fast rule. The reason I'm saying these all things is because most of times we misinterpret. We have very limited amount of information. If you see, the person has put his certain amount of information and I don't know what place he is, what kind of a food habits he has, why did it initially came, did their parents also have all those medical history data. I have no prior understanding. What is his HbA1c level? 306. What range he is? Is he almost pre-diabetic? What range he is falling into? So many there are many things that is unanswered in this question also. So I've given a very generic answer. So make sure that you take the things which you need. Along with that, please do consult to understand what is your case scenario. Each individual is very different, and to answer each individual you need to sit down with the doctor to get your answers. So with that, I'll take a leave. Make sure that you drop your questions in the comment section so that I can pick. Please don't be very specific that you are in so and so, so and so. In this whole journey, make sure that whatever you're feeling, whatever your thoughts are there, write them those thoughts also so that I can pick those thoughts and I can explain it to you that why are you exactly feeling those thoughts, what is going behind, how your mind, body, and everything is acting. I can explain and decode them. So please make sure that you write down these things and be specific. Do not uh, write a very lengthy question. Please make sure that you write it precise so that I can answer you in detail. With that, I'll take a leave. Have a great week. Take care of your health. There are various links in the description. Please do click on them and check out what is that we are doing and how are we adding value in the coming days and how are we adding value each time. With that, I hope you will take care of your health and also go through all these links and other aspects and give your comments or the thoughts on the comment section. Also, what kind of a questions you want me to answer, please write those questions also so that I can answer next time, bring those questions and decode them in front of you on the next Wednesday. So with that, I'll take a leave. Have a great week and take care of your health.